BC Motindro Lataro now. Yes, I've been waiting. I'm at COWLSO bus stop. Yes. Where's the dispatch rider? Please, please now. You know I need this thing, please. BC Motindro Lataro now. Yes, I've been waiting. Okay. I'm at COWLSO bus stop. What time? Yes.
Good morning.
Where's the dispatch
How
rider?
was yesterday?
All right, I'll be waiting. Please, just now. You know I need this thing.
I'm coming to give you the
Please.
food.
BC Motindro Lataro now.
That's very heavy.
Yes, I've been
Let me
waiting.
put this trash.
Okay. I'm at COWLSO bus stop. What time? Yes.
Good morning.
Where's the dispatch
How was
rider?
Madam,
Please, just now. You know I need
coming
this
to
thing.
give you
Please.
the food.
BC Motindro Lataro now.
That's very
What
heavy.
do you mean?
Let me put this
You don't know that I'm
trash.
throwing rubber on
Yes.
water. You be causing blood. Yes.
Good morning.
Where's the
How
dispatch
was
rider?
yesterday?
Madam, wait, please, just now. You know I need this thing. Please. BC Motindro Lataro now. What do you mean? You don't know that I'm throwing rubber on water. You be causing blood. Yes. Where's the dispatch rider?
You called me now. Yes. Yeah.
The Committee of Wives of
Hi there, my name is Dante, and in just a few minutes, I'm going to show you everything you need to know about booking Coworker Feud with Confetti.
The Committee of Wives of Lagos State officials has called on Nigerian women to go beyond certain boundaries to be self-reliant and enrich their communities. The COWLSO chairman and wife of the Lagos State Governor, Claudia Ibijoke Sanwo-Olu,
we are one, we are COWLSO, and we stand by our husbands. We are the mothers of the land. We will build with our hands a Lagos filled with greatness. We are strong. We are COWLSO, Okoniwa. We will serve our land. We will stand for our people. We will rise and together we will build our home. We are strong. We are COWLSO, Okoniwa. Committee of Wives of Lagos State officials. Inú ilé obìnrin ló kọ́mọ lérò. Committee of Wives of Lagos State officials. Inú ayé obìnrin ló kọ́mọ lérò. We are strong. We are COWLSO, Okoniwa. We are strong. We are COWLSO, Okoniwa.
Good evening, everyone. Awesome time to be here. How is everyone doing? I hope we're doing well. I hope everything is going great. Of course, this is our medical podcast. This is the last one for the year 2024. I'm sure the medical think tank, they have something powerful for us today. It's great for us all to be here. If I can see we're just 20 on this Zoom. Let's endeavor to share, you know, invite as many people as possible, friends and family. We're talking about our health. And then, of course, like they say, health is wealth. So it's important we all sit tight, take notes if possible, have our pads, have our writing materials, get ready to ask questions because we do have seasoned professionals that we invite for the medical podcast, people that have been trained and they're experts subject matters more or less, like they know what they're talking about, they know their onions. Okay, so at this point I will be handing over to the facilitator of this medical podcast, and that's in person of Mrs. Tawal. She's a member of the medical think tank committee. We'll be seeing her face next. Mrs. Tawal, are you on the call? Do you have your video on?
Yes, can you hear me?
Yes, I can hear you.
Okay, good.
So
Just to
over
confirm
to
that
you.
you can hear me.
Over to you. Thank you.
Okay. Hello, good evening, everyone. I hope everyone can hear me. Good evening,
Yes,
Ma.
please, we can hear you.
Okay, thank you. Good evening, HE. Good evening, HEDG. Thank you for having us here. Good evening, everyone. For the purpose of those that are just joining, Ms. Oloruni, do you think we should go for the anthem again, or should I just go ahead? Okay, anyway, I'll just go ahead.
Please go ahead. Go ahead.
Okay.
You have the floor. Over to you.
Okay, so thank you for joining, everyone. as we all know, we've had this podcast since April. And I remember that for Medical Think Tank, it used to be just the, what's it called? The medical checkup for every member. And then sometime beginning of this year, HE thought that it's best for us to do something different so that people can learn and things that would impact our health positively. So she decided that we should come up with a podcast. She said we should come up with a podcast. And then so far since April, we've had 7 podcasts, and this is the 8th one. So just to take back our memory to the podcast that we've had so far. I know that in April we had the podcast on mental health and wellness, which was done by Professor Luro Timikoka. In May, we had the importance of regular health screening by Dr. Jimmy Shodipo. We also had the sudden death causes and risk factors by Dr. Adiola Ajibari. And then in July, we had the lifestyle medicine, which is the role of diet, exercise, and fitness. And that was done by Dr. Eniola Awolola and also Miss Bimbo Balogun. In August, we had the topic eye care and glaucoma, and that was done by Dr. Ibukun Adeogun. Following that, the month after, we had the menopause and andropause, and that was done by pharmacist Musumola Dusumu. In October, that was last month, we had the reproductive health and cancer awareness by Dr. Mrs. Tolulope Fagorala. And now this month, we're going to have the importance of regular dental care, and that will be taught to us by Dr. Omoshibi Temitope Olabisi. I know that a lot of us, we don't have many of us on the podcast now, and I would like us to go back and think about something you feel like we could add more to our podcast, as well as things you think that we could have done differently. So I don't know if anyone wants to throw in any what's it called? Any opinion that some things we should have done differently, and also other kind of questions, or I said questions, topics we could bring on board if we're going to continue this. Can you hear me?
Yes, please, but you're breaking a bit. Breaking, ma.
Okay. Can you hear me well now?
Yes.
Yes,
Okay.
you can.
All
Thank
right.
you.
So did you hear what I said last?
No, you were breaking.
Okay, so I kind of mentioned all the topics of podcasts that we've had. So I said that, is there anything we could have done differently? Does anyone have anything to say to the things that we could have done differently? Is there any topic you think, because this is the last topic, the dental care, importance of dental care. And is there any topic you feel like we could bring on board next month? We could bring in next month to help with this, for the continuation of this podcast? Am I still breaking?
No, you're not.
Okay. Thank you. Does anybody want to say anything? In the absence of no comment or nothing, I think I'll have to move forward. So can I ask some questions, please? Can I ask the house that with for all the podcasts that we've had so far from April till now, does anyone have a favorite podcast, and why is that? Is there anyone you think really touched you personally, or is there any topic that you want us to do again that you really feel like you learned from, or you feel like you didn't learn enough and you want to learn more? Hello?
We're here, ma.
Okay. So, okay, I think I'll go to the chat.
Sorry,
So,
good evening, everyone.
okay.
Sorry, Mr. Shino. For me, I would love Professor Kuka to come back because mental health
Sorry, who's
is
speaking,
really.
please?
Can
Okay,
you
Mrs.
hear me,
Angela.
please?
Okay. Hello, good evening.
Good evening, Mr. Shino. Can you hear me now? Am I breaking? Hello?
I can hear you. I can
Okay,
I,
can
I
hear
can
me.
hear you. I think my
Okay.
network is bad. I'm beginning to see that my network is bad because you are breaking now as well.
Okay. Can any other
Okay.
person hear me, please?
I can hear you very well.
Okay, ma. Thank you.
Okay.
Thank you,
Please
doctor.
hold on a minute.
Okay.
I would have to switch. I'm sorry. I need to switch network. Uh, sorry.
Is that Mrs. Angela?
Yes, please. Yes,
Oh,
doctor.
all right,
Good
ma.
evening.
Okay.
Yes, ma'am.
You can go on.
Okay, ma.
Okay, for me, I said I wouldn't mind Professor Coker coming back, because of mental health issues, is really important for our well-being. So I don't mind him coming back, calling him back, for
Okay.
next year. And then yes, you can bring him up, please. It's very important. And I love his lectures and all that, his presentations.
Oh, good. Thank you.
Thank you.
Said. Any other one? So does anyone have any topic for the medical professionals in the house, apart from those in medical think tank? Is there any topic you feel like we can bring again? Sorry, we can add to what we have before. So I know that Mrs. Angela said that she wants us to bring back the mental health and awareness. However, is there any other topic you will want us to add to what we have before?
Sorry, this is Mrs. Adedewe. I'm struggling to raise my hand. The
Oh,
Zoom
okay.
is not allowing me to raise my hand, so
Okay, you
apologies.
can go ahead and talk.
Yeah.
Thank you, Mrs.
Just to
Adedewe.
say that this is the second one I'm joining so far. I
Oh.
think I joined the importance of regular medical checkup,
Oh, okay.
and that was actually quite good. I'm just making a comment that this is a very, very important forum actually to join
Okay, thank you.
and contribute to as well. Just wondering, how do I get feature links? So this I get through Her Excellency,
Okay.
but not necessarily all the time. How do I join the monthly? Is it it's monthly, isn't it?
Yeah, it's monthly. However, there's none happening next month because of the festive
Oh, okay.
period. Um, I think we can. I will let the council secretary speak to this, Mrs. Olorino or Dr. Osoyitolu. Is there anything you want to say about? Are you a council member, ma?
I'm not a council member,
Okay.
but
Okay.
I receive link from Her Excellency
Okay.
now and
Oh,
then.
okay.
I'm a
Okay.
mental health nurse, well,
Oh,
mental health
nice.
nurse lead in the UK
Oh,
myself.
okay. Oh, okay, nice. Okay, I know that we have this podcast is every last Friday of the month.
Last
So
Friday.
this is the last one for this session. So this is
All right.
this is the 8th one and this is the last one for the year. So next year, I'm not sure we're going to start in January.
Okay.
Yes. Well, I don't know if you can drop your email in the chat box and we'll probably send you an email when anyone wants to start again and let you know.
Okay. Thank you.
Yes, please drop your email in the chat box. Thank you very much.
Mrs. Oshinowo, yeah, please, and her phone number as well.
Yes, okay. Okay.
Thank you. I will.
All right, ma. Thank you.
Okay, thank you. Thank you very much. Okay. So, any other person, please? This was the time. Okay.
Hello,
Okay.
good evening.
Good evening. Good
Yes,
evening.
yes, my name is Sarah Takinloye.
Okay. Hello, good
Yes,
evening.
good evening. All right, mine is just like I wouldn't say maybe like a suggestion. Okay, because I feel that just like somebody said, she's calling from London. Is it possible, or do we have a way we can compile all this and put it in like a booklet? I'm looking at Beyond This Time. All of
Okay.
the topics you've spoken about are all important one way or the other.
Okay.
And especially because, some people are faced with, I mean, one of the topic or the other at different times of their life. So I'm
Definitely.
looking at a situation whereby we can compile. I'm sure most of these people that we do invite, they do have notes. We can put their notes together and see if we can make it into a booklet, and then it will be useful, going forward and beyond now. So that's my suggestion.
Thank
We
you
can
Mm.
very much.
even name it something COWLSO or whatever, but then it's applicable to all, and people can always read up or look at it anytime. So that's
Okay.
my
Thank
suggestion. Thank you.
you so much. That's very good. Thank you, ma. That's from Mrs. Sarah Tapiloy. Do we have any other suggestions or any other suggestion? So I would like to also ask that for council members, or for those that no, yeah, well, for council members, to be honest, is there anything you want the medical think tank group to add to their program? So I know we have the medical screening that we do every year, and then we've added the podcast. Do you think there's anything else you feel that as medical professionals we can add to our yearly program that would benefit everybody and also council members? Any suggestion, please? Hello? So, okay, I think there's no more answers. Okay, Mrs. Ainde, just raise their hands. I can see a sign that someone is raising their hands. Okay. Mrs.
Thank you
Ainde,
very much,
yes, thank you, ma'am. Thank you,
Mr.
ma'am.
Shinawa.
Yes,
I
ma'am.
want to appreciate the medical team and the First Lady for this program. I want to say that what we have on ground is a very good one. The icing on the cake will be the suggestion by the last one of the speakers that we should document all that we have done to have into a booklet, a handbook. Even those who have missed the past ones, and it can always be a point of reference. When anyone is in any situation, can always take the booklet and look through. It will be a saving guide
Yes.
for everyone. So that's a good one. You're doing a good one, a good job. Thank you very much. Keep it up.
Thank you, ma. Thank you so much. Okay, any other suggestion? Thank you, Mrs. Odainde.
Good evening. Good evening.
Good evening, Mrs. Mustafa. Good evening, ma'am.
Yes. So I was also thinking that, training on first aid or
Yes.
CPR training, because of all the things that are, happening around us. Sometimes it's not only left to medical, should not only be left to the medical professionals, to act when there is a medical emergency. So
Yes.
I was thinking that if we could have a training, even if it is just the basic one, that would be beneficial. So anybody, even if you're not in the medical field, you'll be able to respond in an emergency situation.
Okay, thank you. Okay, thank you very much, Mrs. Mustafa. That makes a lot of sense. Also, I would like to read some of the comments in the chat box. Someone has said that they have joined the Menopause Club through the last teaching, thereby giving them more enlightened more enlightenment or something, more enlightenment on the issue. The lady speakers, okay, yes. So that's a good one as well. That's part of the impact that this podcast have had on people. And so, okay, someone wants us to document and it should be sent into everyone's inbox. So I don't know what they mean by inbox, email probably. Okay, so the one is sent to their email. So probably document all this and probably send a soft copy to everyone's email so that they can go back and refer to it at any point. So I think that's
Mrs.
it for the
Oshino, I would like to also add to that.
okay.
As regards documentation, I think we're doing a great job, because aside from the fact that we hold the podcasts, we're also able to share it live on our on our YouTube.
Wow,
So
that's
the
good.
YouTube is more like our archive of some sorts, where
Oh.
it's open for friends, family, even council members to go back and watch. Those that are not even here right now and would love to, be part of what we're doing, but maybe because of time or they are not chanced or something, they can always just go back to YouTube and watch everything that we have done. So that's also part of the documentation, that we have done, that is like to go right now. If anyone needs any information at all on any past topic, you can actually get it on YouTube. You can get it on We Are COWLSO. That's our channel on YouTube. Thank you
Okay.
very much.
All right. Thank you, Mrs. Olorun. Okay. Any more suggestions? And I think a last question, sorry. I just wanted to know that, did we meet your expectations regarding the podcasts? I just want to ask the house. Did we meet your expectations? Were we good enough? Okay, I think there's no answer to that. Okay, so I think we'll have to continue.
The answers are
Hello?
dropping. The answers are dropping in.
Oh, yes. Okay, yes. People are saying yes. Thank you very much. Oh, thank you so much. Awesome.
Absolutely.
Somebody said awesome. Thank you, Mrs. Shakira Bayu. Thank you, Mrs. Akewishola. Thank you, everyone. Thank you, Mrs. Rodayinde. Thank you so much. Mrs. Adidewe, thank you. Mrs. Yemisi Erile, thank you so much. Mrs. Salami, thank you. Mrs. Bajumo, thank you. Thank you, everyone. So we'd like to continue with our podcast now. So the topic for today is dental. Let me be sure of what I'm saying. Sorry, apologies. Okay.
Importance of dental care.
Okay, sorry, importance of dental care. And this will be taken by Dr. Temitope Omoshebi. I'll read out a little bit about Dr. Omoshebi. So Dr. Omoshebi is a certified restorative dentist and fellow of the West African College of Surgeons with over a decade of experience. She's a consultant in restorative dentistry at Lagos State University Teaching Hospital, Lagos, and an associate lecturer at Lagos State University College of Medicine, LASOCOM. She specializes in advanced restorative procedures such as crown and bridge work, veneers, surgical endodontics, and the management of dental trauma. Dr. Omoshebi is also an active member of several professional medical and dental associations and has published multiple research papers in her field. And she is presently the publicity secretary for Medical Women Association of Nigeria, which is M1, the Lagos State branch. Can we kindly welcome Dr. Temitope Omoshebi to the podcast? Dr. Omoshebi, you have the floor.
Yeah. Good evening.
Good evening.
Good
Thank
evening,
you so
Mrs.
much.
Ashinoa. Thank you
Thank
so
you.
much. Yeah.
Thank you.
Nice hearing
Thank
from
you.
you again. And
Thank you so much.
also Mrs. Mustafa I've been communicating with two of you people earlier. So good evening, everyone, ma. So good evening to the great leaders, the ever young-looking mommies and ladies in the house. Thank you so much. So before I start my presentation, so I want to appreciate the host, His Excellency Dr. Mrs. Ibijoke Sowolu, the First Lady of Lagos State, and Chief Mrs. Oluremi Amzat, the wife of the Deputy Governor of Lagos State. So I really thank you for this outstanding contribution to Lagos State. And also my special love to Professor Mrs. Adeyeye and all the committee of medical think tank for this great initiative. God bless you.
Thank you so much.
So can I share my slide?
Yes, you can. Can share your screen.
Okay, once again, I'm Dr. Omoshebi. So I'll be talking about the importance.
Dr. Moshebi, sorry to butt in. We're so sorry about that. I will crave your indulgence for us to start our pre-test before you give us everything that you have for us. So we just want to test the knowledge of our members and see if they're up, like just for them to understand more of what you're talking about. I understand that you shared the pre-test and post-test with us, so
I'll do that.
yes, so we'd just like to share that, and then you can just we'll let you know when you start. Is that okay, ma?
Yeah, sure.
All right, thank you very much. So
Okay.
Mrs. Tower, is it okay? Can I launch now?
Yeah, you can share it, Mrs. Olorino. Please, thank you.
All right, thank you.
Sorry about that. It was a mishap. My mistake.
Okay, all right. So at this time, we should be able to see the pre-tests. So let's just go ahead. We have just 5 minutes for us to put in our answers. Please, I'll be able to see your communication more on the chat group. So let me know if you can see the pre-test, please. Are we all able to see the pre-test? Yes or no? I'm not seeing anything in the chat.
Yes. Can you see anything in the chat now?
Okay, I'm seeing no, no, no. I'm seeing yes, no. Okay, so let me start. Yeah, it's up there. Yeah, people are answering now.
Okay.
Okay.
Yeah, I think it's working now. Yes, I can see that too.
Yeah, Excellency is on the call. You're welcome, ma. Dr. Mrs. Cordiana Ibijoke Sowolu. Thank you so much for joining us, ma. The pre-test will be on our device, whatever device that we're using. If it's the laptop or your phone, it should pop up on the phone. I can see people answering the pre-test. Mrs. Bawale, you can't see it. Are you using a laptop or your phone?
I'm using my phone, ma.
Okay. Can you try moving your screen, maybe back and forth? Is there a way? Yes, just try.
So
swap the screen.
Okay.
So we still have 2 more minutes for people to give us their pre-test. There are just 5 questions.
So we need more people to participate. Okay, yes, I think it's coming up now.
Yeah, I can see 51% have
Yeah,
participated.
yes.
Yeah, it'd be great if everyone can participate.
Now 53. It's getting better.
Okay, so Mrs. Victoria Odushikbe, most likely we'll do it as a post-test. So maybe at that time, it will come up again. Because if I do try to
Okay.
resend, then all of this information goes.
Good, okay. So we'll do it again at the end of the podcast.
Yes, we will. So we have just 50 more seconds left. Thirty more seconds. Thank you. Thank you, everyone. Okay, so Mrs. Bawale, can you see the pre-test now? Oh, okay. All right. Dr. Bawale was able to. All right. Thank you very much, ma'am. All right. So, Dr. Moshebi, over to you, ma'am.
Okay, thank you. I learned that the First Lady is in now, so let me appreciate him once again. Good evening, Ma. My sincere appreciation to you, Ma, Her Excellency, Dr. Mrs. Claudiana Ibijoke-Sanwo-Olu. I really thank you for giving me the opportunity to present before the council member. I also appreciate you for your outstanding contribution to Lagos State. Thank you, Ma. So let me share my slide. Can you see my slide?
Yes, we can.
Okay.
Yes.
Good evening, everyone, once again. I'm Dr. Omoshebi. So I'll be talking on the importance of dental care, or regular dental care. I think you people mentioned the importance of dental care, but regular is very, very important. So I'm talking about importance of regular dental care. So what do we really understand as dental care? I'm sure most people might not have even visited a dentist before. A lot of people don't actually even know the meaning of some dental care that they are meant to look into or observe every day, every morning. So dental care refers to the overall care of your teeth and the other oral tissues. So the good oral and dental hygiene can help prevent the bad breath, tooth decay, gum disease, and can also help your teeth as you get older. And there's what we call the dental plaque, which is a soft whitish deposit that forms on the surface of teeth. And if left over time, it hardens to become a calculus. Most times, we tend to neglect the care of our teeth. And by the time they don't brush regularly, or maybe just brush once daily, in the evening, we just take what we want to eat and we go to sleep. So before the following day, we have some form of deposit on your teeth. And this actually stands as a form of retention for those bacteria to be able to stay attached to your teeth and can cause damages to all the ligaments, the structure that's holding the teeth in place. So what do we do with our, by the time you go for your dental visit, what do they want to check? What does the dentist want to check? So first of all, the dentist, because most people always talk about dentists, teeth. It's not just about the teeth. It's all the structures on your face, your neck, the lymph nodes, the joints, even all the bones that make up the frame of your face. So by the time you get to the dentist, they want to examine your face, your neck, also to check for your lymph nodes, if there's any form of infection, and also to examine your TMJ, we call it temporomandibular joint. Because sometimes, especially the bankers, people that have a rigorous work, because from the little research we had in our center, we realized that people that work, especially the banker, usually present with what they call a TMJ disorder or temporomandibular disorder. They usually complain of pain around the joint of their face. So by the time they visit the dentist, we're able to examine the gums. If they are not inflamed, that's what we call the gingivitis. We also check if there are any loose teeth, because sometimes some people, they won't even know that they have diabetes, but by the time they present in dental clinic, we realize that they have some loose teeth, but by the time we check the teeth, there are no any form of maybe calculus, there are no debris on the teeth. The teeth still look clean, but almost all the teeth, they are mobile at the same time. So we tend to tell the person to go and do some blood check to actually check for the sugar level. So we also examine your tongue. By the time you get to the dentist to examine your tongue, it's not just related to dental diseases alone. There are a lot of systemic conditions, some diseases in the body that manifest in the mouth. Like examining your tongue, sometimes we tend to find some oral crush that is maybe due to HIV. Looking for visual evidence of tooth decay, you want to check if there are broken teeth. Some might be complaining, my teeth are very sensitive. They're having hypersensitive teeth. But by the time we check that, we realize that some parts of the teeth are broken. We also want to check if there are damaged fillings, because some might have filled their teeth, but the fillings are removed or they're broken away from the tooth. So we want to check for those. We also want to check for the changes in the gum that's covering the teeth. We want to evaluate if there's any appliances, because sometimes some people they are using denture, the artificial teeth that they remove and put back. So we want to actually see if they are still well fitted in the mouth. We also want to check if there are any contacts between your teeth, because sometimes if you don't have a perfect occlusion, the teeth are not occluding well, it can also give rise to what we call the TMJ pain. You usually have the pain around your face. And also we want to take your radiograph for in case, because sometimes there are some infection that is happening down the bone, but by the time we just check, or maybe your friend able to look at it, you might not actually see, but by the time you take the radiograph, you'll be able to know what is happening down the bone. So why this dental care? So regular dental visits are very important because it helps to keep our teeth and gums healthy. Because if they are, if you have any form of inflammation of the gum, which is called gingivitis, or you have a decay in the tooth, which we call dental caries, of course, there'll be associated pain, there'll be inflammation, there'll be discomfort. So during the checkup, your dental professional will check the overall health of the trouble areas, and it also helps you to keep your teeth clean, because there are some substances that are deposited on your teeth, in which we call the plaque or calculus. And this tartar or calculus, they are like a retentive device for all those bacteria in the mouth to be able to adhere there. So most of the time, because they are there, they tend to destroy the supporting structures of the teeth. They destroy the teeth, there'll be a form of decay. Also the gum, there might be some form of infection. But by the time you present in the dental clinic, we can refer you to where you do your scaling and polishing, like what we are seeing here. We do scaling and polishing so that we can reduce those debris from the tooth. Normally, the body's natural defenses and good oral health care, we preach to people that we should brush our teeth twice daily. Some might be wondering why, but we prefer that when you wake up in the morning, you can eat your food even before brushing, But before you leave the house, you can brush because you've already brushed a night before. So by the time you brush a night before and you wake up in the morning, your mouth, you feel, even yourself, you feel it, you feel fresh. You can eat your food and then brush before going to work. And we can also do what they call flossing. Sometimes the brush cannot get in between the teeth. This cannot get into the interdental spaces. So we tend to use what they call flossing and floss. And there are some flosses that they have some sharp hand. We are not meant to use the sharp hand. We are meant to use the rope part. And some, we also discourage the use of a toothpick because by the time you are using the toothpick to remove the food debris that is stuck in between your teeth inside the gum, you are even trying to create more room for those bacteria to be able to stay. And at the same time, we'll be presenting give you a form of discomfort or some dull pain around your teeth. So, however, without proper professional oral hygiene, bacteria can reach the level that might lead to oral infection, such as tooth decay and the gum diseases in which I explained earlier. So after the examination, you've already done your routine check, they've already examined your teeth. So it is very important for you to do your routine scaling and polishing. You don't have to wait that, oh, I have some decay on my teeth. I mean, I have some food debris, I have scapulars. It is advisable that you clean it every 6 months, and this will help you to maintain a good oral health. It will eliminate the risk of tooth decay, periodontal disease, and subsequently, it can also help you to eliminate bad breath. Because sometimes when your teeth are filled with a lot of food particles, all those calculus that the toothbrush cannot actually remove, you tend to have some form of halitosis. We call it bad breath, literally, but we call it, medical, we call it halitosis. Your mouth, by the time you close your mouth and open it, you'll be having some bad odor or bad breath from the mouth. So regular dental visit enables early detection of all these curious teeth. Sometimes some people will present in the clinic and you'll be wondering that how come, what was this patient waiting for till the teeth has already become, the cavity has gone so large. But by the time you come early, when that is even the dentist that was able to pick up the decay, it is easier for you to treat compared to when the tooth has been destroyed, that we have to remove the tooth or do some invasive treatment like root canal therapy. But by the time you come to the clinic early and we can pick it at the early stage, it is easier for us to do what they call the minimally invasive procedure, that you don't have to draw more on the tooth, just make a little preparation on the tooth that won't take long time. So neglecting your dental visits puts you at risk of gum infection, in which we call gingivitis, and this now may lead to you losing those teeth. And sometimes there are some dental problems that can come with it, we call osteomyelitis. Let me just take you back and tell you the sequelae. For example, like this, your teeth has a hole, you didn't come on time, the hole will get the part, you start having pain. So most of the time, we do what they call root canal therapy, which is quite invasive. And if we cannot restore the tooth using the root canal therapy, we tend to extract the tooth. Even sometimes, because they don't even come on time, the tooth are even having some form of complication, because as we are growing old, our immune system cannot be able to defend some form of infection again. So from there, we can have what they call osteomyelitis, we can have abscess, we can also have what they call logic angina, especially the people that are malnourished. And this logic angina can spread to the chest, and under 24 hours, the patient can pack up. So sometimes we should not just neglect our teeth. That is it just teeth? So our teeth is very, very important. So maintaining your overall health, the condition of your mouth is closely tied to your overall health, because what you take inside the body is entry through the mouth. So poor oral health has been linked to some different health conditions, like what I said earlier, diabetes. Sometimes you just have some mobile teeth, some teeth are just moving. You look at it, there's no form of plaque, no form of food debris, no form of calculus around the body. Teeth will just be mobile, like greater mobility. So by the time we tell the patient, we write we tell the patient to go and run some tests, realize that they actually have uncontrolled diabetes, even some heart disease condition. too is also being considered. So an assessment of your mouth can reveal some signs and symptoms of some health issues that can affect your general well-being. Even the symptoms of this, such as the HIV, oral cancer manifest in the mouth, which by the time they present on time, it will make us to be able to have early diagnosis. And when you have an early diagnosis, it makes our prognosis to be better. So research has linked heart problems to gum disease that result from poor oral hygiene. And a regular checkup will ensure your teeth are clean, helping to reduce the chances of developing this heart condition. So taking care of your teeth goes beyond just having a good breath and a bright smile. It can also give you overall health. It's not just about my teeth, okay, about my aesthetics, about my appearance. It goes beyond that. It can also help you with to have an optimal health. So how often does one require dental care? I'm sure that if I ask the house that, has anybody visited a dental clinic this year? I'm sure that a lot of people will say no. That I don't have any headache, I don't have any reason for me to go to visit a dentist. But I mean, bringing it before you people that it is good for you to visit your dentist once a year, every 6 months. So you just have your routine scaling and polishing done. And we also advise parents, I know we are all mothers here, that we should take our children to see the dentist at least 6 months after the first tooth eruption into the mouth. Also, we want there are some other related diseases that can be caught early, like what I explained earlier, that are caught early when we go for our regular dental appointments. So how do we maintain a good oral hygiene? Even before seeing the dentist, that what you practice in your house, what you practice within your environment, your own. Apart from the regular visit to the dentist, it's advisable that you brush your teeth twice daily. And some people, I'm sure that some of our old women, some still use the chewing stick. We don't discourage. Some people, they say that a chewing stick is not good. We don't discourage, because sometimes when we move into the public health, there are some things that some people, they are accustomed to their culture. They still believe in that chewing stick. Once we just advise them, for us, maybe your mothers believe in chewing stick or your father believe in chewing stick. So what we just tell them that they should first chew the stick to make it soft. So they now use the softer parts. You put just toothpaste on it, and they can use it to clean around their teeth. So when you put your toothbrush on, your toothpaste on your toothbrush, most of us, after we've already brushed our teeth, we can use all the water in the world to be rinsing. No, because we don't want us to rinse so much. Sometimes we even say that don't even rinse, or just spit out the paste, or you rinse just once, because we still want the effect of the toothpaste to be on that teeth, because the toothpaste has some form of a different composition. It has fluoride, and that fluoride helps to straighten our teeth. So by the time we rinse it off so much, we've already removed of course, when we are brushing, I'm mistaken its effect, but at the same time, when we allow some to be left on the teeth surfaces, it will also help to remineralize. Maybe, for example, you have a tiny carious lesion, maybe your teeth is having at the early stage of a carious cavity. It help us to minimize the progression of limit the progression of the dental caries with the help of the toothpaste. So it is recommended that only a piece size, not that by the time we put our paste, the thing will look so long on the toothbrush. Just a piece size amount of toothpaste, about 0.5 grams, can be used. And you have to replace your toothbrush. Some people can use a toothbrush for 7 months, 8 months, even up to a year. So we advise to replace our toothbrushes every 3 to 4 months. And we should avoid using our teeth as an instrument to open bottles, to break or cut things. This can lead to teeth fracture and may lead to an eventual loss of the tooth and teeth involved. Let me break it down. Most people tend to use their teeth as an instrument, which is very, very bad, because by the time you are using your teeth to open bottles, you are using your teeth to cut thread, you are using your teeth to bite nails, it will be wearing off the surfaces of your teeth. Later on, as we age, you now say that, okay, I'm having some sensitivity. By the time I take water, I'm having some sensitivity. So it's advisable that when you want to open your bottle, of course, use the opener As we also advise that when you are like 45 years old or maybe 40 years older, we advise so that when you want to eat your apple, try and get a knife, cut the apple. We should stop using our teeth to cut the apple. We can use our knife to piece the apple so that you can chew it. You take it to the back of your teeth and chew. It's hard because sometimes all those fruits, they are acidic. By the time you are dipping your teeth inside apple, you are dipping your teeth into maybe like you are using it to cut pineapple, the acidic content in those fruits will also form some form of erosion around your teeth, which can make your teeth to be sensitive too. So we're talking about the tooth. Before I round up, I want to show you the proper way of brushing our teeth. When you are brushing your teeth, the type of toothbrush, we don't want a toothbrush that the head is too long. As you can see here from my cursor, we want the total length of the brush to cover just about 2 or 3 teeth at the same time. So when you are brushing the upper teeth, you brush away from the gum. That means you are coming from up down. So when you are brushing the lower teeth, that means you are coming from the gum up. That means it will be upward. We don't brush it vertically, because as you are brushing it that way, you are causing injury to the gum, which is the supporting structure to that tooth that's holding the tooth. You are destroying those what they call it, the supporting tissue that's holding the teeth. So over time, you might tend to have some form of mobility also. And again, when you are using a toothbrush, we want a medium texture toothbrush. We don't want a toothbrush that is very hard. Some say that I want to use smoker's toothbrush so that my teeth can be white. No. It will also expose your teeth to sensitivity. It's just as if you are using a metal brush, a metal iron sponge in your house towards the back of your pot. Over time, you realize that you are removing part of the component of that pot. Likewise, our teeth. So we just need a medium texture toothbrush, and we don't need too much of the intensity. It's just about the way, your technique of brushing. And by the time you are brushing, if you are brushing one side, you can brush down one side within 1 minute or 2 minutes. So by the time you are done brushing the outside, you go in. A lot of people tend to neglect from this step 2. Most people forget to brush this aspect. So that aspect is also very, very important. So you can see step 4, also down to step 5. By the time you are done with the inner surface of the teeth, you also have to brush the occlusal surfaces of the top of your teeth. So in conclusion, the regular dental care ensures that you maintain a good oral hygiene. It improves your oral functions such as eating and speech or communication. It also helps to maintain overall health as well as improve social integration. Thank you.
Thank you very much, Dr. Omoshebi. Thank you so much for this lecture. We really appreciate it. I would like to ask anyone here if they have any questions for us because of time. Do you have any questions for Dr. Omoshebi? Questions, please. The floor is open for questions. Can you hear me?
Yes.
Dr. Omoshebi, can you hear me?
Yes, I can hear you.
Okay, good.
Yes,
Okay, so does anyone have any question?
Like everyone is practicing regular important. They know how to take care of their dental.
So everyone
routine
is clear on how to brush their teeth. Everyone has been to the dentist before.
I have a question, Mrs. Oshinowo. So, Mr.
Okay,
Moshebi, Dr. Moshebi, thank you very, very much for this enlightening session. Thank you so much. So my question to you now is, what should we look for when we are buying a toothpaste? Because there are so many of them now. So what exactly should we look for? Or what should a good toothpaste contain? Thank you very much.
Okay, thank you,
Thank
ma'am,
you for that question.
So when we are buying a toothpaste, what we are actually looking for is the fluoride content. Fluoride content. So there's some the FDA, we call it the Federal Dental International. There are some toothpaste that are recognized that they actually have those fluoride. Am I permitted to mention some brands?
I think you are, if I'm correct. I think you're permitted to be
For
honest.
some time, yeah.
Yes,
So
ma'am, please.
like all those Colgate, we are sure about their fluoride content. I even had meeting with them last time I went for a conference in New Orleans earlier this year. So I met with their representative. So they put their fluoride content well labeled. Even also the Oral-B, they have their fluoride content intact. But initially there was one brand, what's the name of this brand of toothpaste? Is it Long Reach? We had issue with Long Reach at a particular time. I don't know if the Nigeria Dental Association, they reached a compromise on, because they didn't put fluoride. So we were not comfortable with the paste because it's that fluoride that we really need the fluoride. Like all those close-up also have fluoride, Macleans, they have fluoride. So that fluoride is very, very important for the strengthening of our teeth. Thank you.
Thank you very much for that, Dr. Mashibi. Does anyone have any other question?
There are some questions in the chat.
Okay, so there's a question here that says, can we
also
use
raised up our hand?
charcoal? Can we use charcoal to wash our teeth?
Okay. The charcoal has some corrosive content. So we don't advise the use of charcoal because sometimes, okay, let me just take you back to the structure of the teeth so that we understand what I want to talk about now. So the teeth has the enamel structure. So after the enamel structure, we have the dentin, then the pulp. The enamel is the protective layer, is the white teeth that you see. Sometimes when you look at somebody's teeth, you see the yellow part. The yellow part is the dentin. That's why they're having the sensitivity. So the enamel, the white teeth that you are seeing, is the one that is protecting your teeth from any form of sensitivity. So by the time you are using a corrosive substances or material or charcoal that it has some form of corrosive substances, it tends to over time as you are using it, it tends to erode the surfaces of that enamel, which is the protective layer, the white one. So by the time you take cold water, even ordinary fan is on, you'll be feeling some form of sensitivity around your tooth. And that enamel, we want to keep it. So sometimes, even your toothpaste, there are some that have high abrasive content. That's why I can say that I'm okay with Colgate because the abrasive content is not so high. So we don't want to use the one that has what is the name? High abrasive strength. So we don't want it to erode that enamel. Even your soda, as somebody put it on the chart now, the soda also is quite corrosive. So we don't want to use it on our teeth. And when we are talking about tooth whitening, is another thing entirely. For you to do tooth whitening, there are some procedures that you have to put in place. There are some measures you have to put in place. But in the house, you can't just say, okay, I want to use baking soda because it whitens the tooth. So it tends to erode the enamel, in which we now expose the tooth to sensitivity.
Thank you very much. There's another question here that says, what causes mouth odor in some people? What type of toothpaste and brush makes it better? And also the same person asked, what of Pepsodent toothpaste? Is that okay to use? Does that have fluoride?
Yes, Pepsodent is good. It has a well-controlled abrasive content and it has fluoride. So before I will talk about mouth odor, they said that before you can take care of something, you must know the cause. We can't just manage something without knowing the cause. For example, mouth odor can be caused by a lot of things. We call it multifactorial. Number one, it can be systemic. Let me break it down. When I mean systemic, let me start from the systemic before I come down to the local factors, which is our teeth, anything related to teeth. But the one of the systemic are not coming from the teeth. So when you talk about the systemic diseases, some people have, we call it also reflux, esophageal reflux. Some have ulcer, you understand? So they tend to burst because of the reflux from their abdomen down to the chest, to the thorax. So it tends to, by the time they burst out because of the gas, it can also present as a form of mouth odor. Some that have some diabetic, some people that are diabetic patients, because of some medicator that break down, they tend to have mouth odor. Even some people that have ketones, maybe they have some diseases that usually have the ketone as as some of the things that are released into their blood, they tend to have that mouth odor. You understand? And also an ulcer patient tend to have mouth odor. So that one is systemic. So before you can take care of that, we have to treat the underlying diseases, which is not the dental aspect. Also, when some people have what they call upper respiratory tract infection, especially among the children, I'm sure that sometimes you see maybe your child just opens the mouth, wow, what is this? And you look at the teeth, there are no any form of decay. The person might be having some form of infection like tonsillitis. You understand? Their adenoid might be enlarged. They might have this upper respiratory tract infection. So those ones, they also give you that kind of bad breath. You understand? So those ones, they are systemic. So let me now come down to the one of dental sources, that is the local effects. So those ones can be caused by from the mouth origin. What can cause those mouth odor? For example, like now you have some decaying tooth that you've not treated. You understand? You've not filled the tooth, the holes are there. It can make you to have mouth odor. Sometimes, most of us, we neglect to brush our tongue. So the tongue usually harbors a lot of bacteria, microorganisms. So by the time we are done brushing the teeth, the last place to brush is your tongue. And don't forget, when you are brushing your tongue, do it in a light way. Don't be too hard. You understand? Because we don't even want to instigate another thing on the tongue. You understand? Because the tongue because any form of trauma can expose your tongue even to cancer, to some form of diseases, you understand? So by the time you are brushing your tongue, we don't want any trauma on your tongue. So you brush it gently. You brush your tongue gently. So that one will also make your mouth feel, to have a good breath. And also, I was saying the other time that we should do what they call scaling and polishing every 6 months. When we have the deposit of calculus, some people call it tartar, TAR, you understand? There are some solid material that deposited on your teeth over time that when you brush your teeth, with normal regular toothbrush, it cannot actually take it away. So by the time you do what they call the scaling and polishing, so by the time the therapist help you to remove those ones will also help you to have a good breath. So it will also reduce the mouth odor. Thank you.
Thank you very much, Dr. Moshebi. Hello, Mrs. Sule. She was raising her hand
Hello.
earlier.
Hello.
Okay, hello. Yes, ma. Please go
Yeah,
ahead with
good
your
evening.
question.
Yes, I just want her to give more explanation on mobile teeth.
Okay, on mobile teeth.
Yeah.
Okay. So when we are talking about mobile teeth, there are many things that can cause mobile teeth. First of all, like what I told about the infection around the teeth, which is localized. Maybe you have a lot of calculus around your teeth. You can see the one I showed you from the slide, that there are a lot of debris, a lot of calculus around that tooth. So those things, so it's like a retentive device for all those bacteria. So by the time those bacteria are on those, what's the name? They're on those calculus, it will be releasing some enzymes that tend to destroy the gum. And it's the gum and the periodontal support that holds the tooth in place. So by the time the bacteria that are breaking down, releasing those enzymes to destroy the supporting structure, you tend to have a mobile teeth. But most of the time, you will not have a growth, except that if you have calculus all over your teeth, that you have what they call it, you have a mobile teeth. But sometimes a patient will present in the clinic. You look at the teeth, there are no calculus, The teeth are so, well clean, white, everything. But by the time you examine the tooth, you realize that all the teeth are mobile. Of course, we realize that there's not any form of cause within the oral structure that's supposed to cause the mobility of those teeth. So most of the time, we tell them to go and do what they call blood test, blood sugar. So by the time they do the blood sugar, some of them, they have uncontrolled diabetes. Some might not even have any form of symptoms. It's from the cleaning that will pick that this person actually have diabetes, because this oral manifestation of diabetes, we have tooth mobility as part of them. Thank you.
Thank you.
Okay, I think the last question would be someone has put a question up on the chat box and said, good evening, everyone. How do we treat akukoro?
Once people what people call akokoro, they said akokoro shiwale, you understand? They are talking about some how will I put it? It's dental caries. You understand? It's dental, they're having holes in their teeth. Am I getting the meaning of akokoro?
Yes, you can also speak in Yoruba, ma. Just
Okay.
yes.
Okay. Yeah. So the akokoro, they said that they have akokoro in the mouth, that they are having some what's the name? Some form of, I think, a mucus, not abscess. Okay, it's not dental caries, sorry, it's not hole in the teeth. They have some form of dental abscess around the tooth that sometimes it brings out like a whitish color. So they will be calling it, they call it maggot. But it's not actually maggot, it's an abscess. So they will now go and meet the native people that Eba me find, or that they should help them to remove that maggot. That maggot, it's not maggot, it's an abscess, like onion. You know the meaning of onion, like abscess. So most of the time,
The abscess, yes.
it is when there's a complication, maybe the tooth has had hold for a long time, so it has progressed into what we call pulpitis. They'll be having pain down to the periodontal ligament, down to the tooth. So those bacteria, they will now secure themselves there, destroying those supportive structures, which will now manifest later as an abscess. So by the time they press it, they will see some whitish color. So it's an abscess. So like that kind of patient, when they come to our clinic, we can still do what they call root canal therapy. But if we realize that by the time we are even holding the tooth might even be mobile, we tend to remove the tooth and we place on antibiotics, because we have to remove the source of infection, which is the tooth, because that means the tooth is not, it has really gone bad, because if you don't remove it, it can lead to what I talk about, all those lobric angina, osteomyelitis. It can progress into the systemic part of the body. So we tend to remove the tooth early, especially among the older ones, in which their immune system has already been suppressed due to different medication with comorbidity. Thank you.
Okay. Thank you, Dr.
Thank you very
Omoshebi.
much. Thank you very much, Dr.
Someone sent
Omoshebi.
me a message
Okay, so we
directly.
have a link. Okay.
Yeah, she
What did you
sent me
say?
a message directly. I think she wanted to send it so everyone could see, but it came to me directly, so I'll need to read it. It says, should you
Oh,
brush
okay.
your tongue? If yes, what's the best way to do it?
Okay. It's very important for you to brush your tongue. After you've already brushed your teeth, you've already spat out, you've already bring out the excesses, then you use your toothbrush. When you are brushing your tongue, you do it in a circulating manner. You understand? You don't brush it hard, because we don't want to cause trauma to your tongue. We don't want any form of traumatic injury. We don't want anything to lacerate your tongue. So we tend to brush it gently. And time you are doing it, you go from inside outward like this. Just about 3 times, that's all. But we have to be very careful about that. That's why we cannot use those hard textured toothbrush. We use the medium textured, not the soft, not the hard. We use the medium textured toothbrush. Thank you.
Okay, thank you.
Okay, thank you
Actually, I
very
have some
much.
Mrs. Tower, can I go ahead?
Yes, there's one question in the chat box that I want to read out anyway. It's just a simple one to say, is mouthwash advisable?
Yeah,
Just yes or no to me. Yeah,
mouthwash is like
okay.
advisable, but sometimes we don't want you to use it for a long time because it has its own
Okay.
chemical component. It can stain the tooth over time. You understand?
Okay.
It can stain the tooth over time. Sometimes we use mouthwash based on dentist recommendation, maybe due to some procedures you have done in the hospital. So we just tell them you can continue using this mouthwash and it is time specific. Because sometimes when we use the mouthwash over time, it can stain your tooth and it can also cause some form of erode around the gum of your teeth over time.
Okay. Thank you very much. Mr. Lauren, you can go ahead, please.
Thank you very much. So my question is actually two-faced. So the first of it will be, I understand a lot of celebrities, are using, or rather, they have white teeth, right? And for some of them, they really don't have issues with their teeth, but all of a sudden we just see that it's white and it's clean and it's crystal, that kind of thing. So my question is, number one, how did they get that done, right? That's one. Then two, if anyone is willing to do it or wants to do it, do you have to, like, how much are how much does it cost? And then couple with the fact that if you actually just want to do it for pleasure, does it have any health risk, associated with it? Yeah, so those are my questions pretty much. And I also would need you to also talk a bit about tooth whitening, because the common ones that we know, which is baking soda, charcoal, and all of that, you've come to tell us now that it is not right, it's not good for our teeth. So how do we get our teeth white if
Yes.
Thank you for that question. First of all, before we can say that, okay, I want to do whitening, I want to make my teeth white, some even do what they call veneers. There are different indications for all those treatments. Some, they have tetracycline stain. The teeth are so dark that even if you do whitening, it cannot actually change the color of your teeth. So those are those celebrities, they tend to go for veneers. You understand? Veneers is just about this, it's a minor procedure that you remove some parts, about 0. Just little 0.5 mm of the tooth structure, and tend to fabricate. If I'm trying to use for a simpler language, they tend to fabricate something like a prosthesis that they will insert. It's like a microstructure on that teeth. They are the veneers. So for people that do what's the name? Whitening, most people just do whitening. Even some, they go to some pharmaceutical shop to just get some home-based whitening. Why sometimes, like now, I'm a restorative dentist. Why we discourage people is that some might have what they call cracks on their teeth. Normally, they have cracks. By the time you are doing whitening, it will give you a lot of sensitivity. That is where the professional comes in. You understand? And there are different types of whitening kits, in which the dentists are, okay, this one is okay. That is sometimes good for you to do it in a dental clinic. The dentist will give you the right formulation of the whitening substance. And at the same time, the steps, the procedure. For example, like now, if you want to do a whitening in a dental clinic, any dental clinic, you understand, both the government or the private want to do a whitening in dental clinic, there are some steps after checking your teeth. Hope there are no cracks. Hope there are no fracture. Because those ones, because you want to open up the tools again, you want to injure the person. You understand what I mean? So by the time you are doing that, you first do what they call some prophylaxis. There are some things that you had around the tooth that will minimize the sensitivity. And by the time we are done with the applying those materials, the whitening materials, there are some things I will also apply on the tooth after the whitening that will prevent the what they call it, the complication that might come after the procedure, because most times there will still be some complication in which it will be well managed if done with professionals. Thank you.
Okay, ma. So from what I hear now, what you're saying is, if we want to whiten our teeth, we should go to the dentist.
Yes.
We should not use any form of abrasive material,
Exactly.
as it
Yeah.
were. So there's also something that has become a craze that we see a lot. It has to do with laser whitening. They just put the lights, and then before you know it, if your teeth is black, by the time you come out like this, it's shining white.
Yeah,
So
it's part of the procedure.
okay, it's part of the. Is that
Procedure,
also
yeah,
what the
laser
dentist
whitening, yeah.
does?
Yes. So by the
Oh,
time you apply the material, the substance on your teeth, we use the light. There are different types of white. We have the laser whitening, we have different types, we have the UV light, but laser is faster. So that one just helps to break, we call some things, to break the composition of that whitening product. It makes it faster, but that doesn't make it longer. It reduces the chest side.
right.
You understand?
Mm,
So by the time you apply the substance on the teeth, we use the laser light so that it can break those products, so that it can start working out on micro level. So the patient will not stay long on the chair, but that doesn't mean it make it better.
right.
Yeah.
Okay. So you didn't answer the question as regards how much does veneers cost if one wants to do it.
Veneer, it depends on the clinic. It depends on the clinic. That's it.
Okay. You don't want to tell us? Like, you could actually have some customers here, like you can't say.
Yeah,
I'm
it
telling
depends
you,
on the
that's the fact.
clinic.
Yes.
Promote
So
your clinical, Dr. Mashebi. You don't know who will come knocking tomorrow.
exactly, everyone
Yes,
wants to have white teeth, and I'm sure they wouldn't mind having veneers if it's possible. So please let us know how much it costs.
people like us. I want to have white teeth, I beg, please. Okay. So, does anyone want Dr. Mashibi to share details of our clinic or anything? So,
The
I
thing,
don't know. I don't know. Do you want to share that with us, just in case we want to patronize you or something?
yeah, I work with
Anyone? You work with what?
government.
Oh, okay, okay. So, is your clinic in Lasso?
Yes.
Oh, okay,
Yeah.
okay. All right then. So you can go to Lasso to the dental clinic, and then you will see Dr. Mashibi there, probably on duty. Anyone that wants to have anything done to their teeth or something. Anyway, so I think that's it for the questions. Okay, someone just asked one now and said, I think this should be our last question, to be honest. Can we brush the upper side of our mouth? I think they're talking about the gum, the upper gum. Is it okay
Okay.
to brush?
The
Yeah,
upper gum, you mean the palate?
I don't know what it's called though.
Sorry,
I think so.
is it part of the teeth or
Yes,
here?
yes.
I think that's what the
No, no,
person
no,
is
no.
referring to. The
Yeah.
roof of the mouth.
The roof of the mouth? No,
Yes.
we don't need to brush it. So by the time you are rinsing your mouth, it will take care of that. We don't put brush there. We don't brush the aspect because we don't want to traumatize that place. There are lots of what they call it. There are lots of vessels around that place. Superficial vessels. We don't want to go
All
there.
right. Someone's hand is raised. Mrs. Temitope Adedewe.
Yeah,
You can
thank you.
unmute your mic, ma.
Yes, can you hear me now?
Yes,
Yes.
we can.
Yes. Thank you for the presentation. So I didn't start actually doing regular checkups until 4 or 5 years ago. And my dentist then noticed mild kind of irritation to my gum, and he prescribed, so he could see blood when he did the poking. So he prescribed interdental brushes. So I've been using it since then. But then I think you spoke about using toothpick in between teeth. What is the difference then with the interdental brushes? Because I'm recently actually having pain in my gum with the interdental brushes. Perhaps I'm doing it too aggressive. I'm just wondering what your thoughts are about interdental brushes.
Okay. Thank you, Ma. You mentioned toothpick. We discourage the use of toothpick entirely. We don't use toothpick. You understand? The toothpick destroys the gum more, as if you are burrowing inside the gum, allowing some food particles to get in there more. So we tend to advise people to use that interdental brush and also dental floss. So like that dental floss, by the time you put it in between your teeth and you bring it out, it will take all those food debris or particles that are stuck in there. It will go along with the thread. Also, the interdental brushing, when you are doing it, you don't have to be aggressive about it because it will destroy the gum. You can just do it gently, just like our toothbrush also. But instead of you using interdental brushing all the time, I think it's better you use a dental floss for you to be able to remove those food debris that have been packed in between the teeth. Thank you.
Thank you.
Okay, there's a last question. Someone sent to me directly. The person said, is it better to brush your teeth after eating or before eating?
Yeah, it depends. Like, for example, like maybe before you sleep this night, you brush your teeth before going to bed. And after you've already brushed your teeth, not that, you now see something, oh, let me snack again. No. After you've already maybe snacked, okay, you brush your teeth. And that's the last thing, nothing entering the mouth again. So the next morning, you can go ahead and take anything you want. But before leaving the house, you can brush your teeth. You won't feel it. Just try and do it this night. That's every one of us, bro. By the time you wake up in the morning, you feel fresh. You feel like a good breath. So you can go ahead and take your breakfast. And then after taking your breakfast, so you can brush your teeth and then go to work.
Okay, all right. Thank you very much. Mrs. Rhoda Ide is raising her hands. I think that should be our last question before we share our poll. Mrs. Rhoda Ide, over to you, ma'am.
Thank you. The doctor has not responded to the question on the charcoal toothpaste we have in town now.
Oh,
what's our recommendation?
The charcoal toothpaste from the NDA, because most of all those dental, what they call it, all those dental products, they are regulated by the NDA. But the charcoal products I don't think it's still under I don't think it's under our recommendation. I don't think so. Charcoal toothpaste, because there are many companies that are coming with a lot of products. So I don't know. I can't stand in for the charcoal toothpaste. Thank you.
Okay, all right. Thank you very much, Ma. For that. If we do have any other questions, you can send it to Mrs. Tao, and then she would send it across to Dr. Temitope Moshebi. So, Mrs. Tao, over to you, Ma.
Okay, I think that brings us to the end of the podcast. However, I know that Mrs. Alorino, you wanted to share the post questions again so that people can answer the questions. And also, in the chat box, I shared the link because at the beginning of the podcast, before we started the podcast, there were some questions that were asked. And I know at that point, we had only probably 25 people who joined. So now we have like 57 people on the podcast now. So I shared the link to answer some questions. It's like a Google form. Once you answer the questions, we can get the answers from the back end, and then we can do a report on that. So, Mrs. Olorino, I've just shared the.
I'm gonna do it. I'm gonna do it again so that everyone is,
Okay. Mrs. Olorino, can you hear me well? I'm not breaking, right?
No, you're not. I can hear you well
Thank you
now.
very much. Because I just swapped my internet connection.
Yes, I
again.
figured. Yeah.
Okay. So we can answer the post question now again. We have I think 3 minutes. Is that what you said, Mr. Olorino?
Yes, 3 minutes.
3 minutes to answer the questions, please. So while we're answering the questions, we would like to say our First Lady, Dr. Mrs. Claudiana Abijoke Sonwolu, for making this possible. We've had 8 podcasts so far, and we've all enjoyed it. We've had positive feedback, and this wouldn't have been possible without her. So thank you so much, Ma. We really appreciate you. Next year, I know we'll come up with something more, and with your support and guidance as well. Thank you so much for everything, for supporting the medical think tank committee, for the initiative and all. So thank you, Ma. So we'll continue with our questions. And please, there's a link in the chat box. You can, a Google Form link to, we asked some questions at the beginning of the podcast. At that point, not a lot of people joined at that point. So just a little bit of questions about the podcasts, the ones you've listened to before now. How did you find it? Is there anything you want us to do differently? Is there any other topic you want us to bring on board? Just let us know. And so, okay. I think we have 27% who just participated in the questions.
Yeah. It says just 16 people. Please, let's all try to take part of this post test. We can actually know who and who answered. You know, it is also a way to encourage the medical think tank committee, because they're going to be doing impact assessments. They're going to be writing their reports, and it's things like this that will help them, you know, to give facts and specifics, and also be able to, you know, work on improving what they've started already.
Yes.
So please, let's all try to participate in this.
So I'll share the link again to answer some questions. So there's a link in the chat box. Please use that link to fill the Google form. Also, you can then do the post questions on here, right here. Thank you.
I also posted it on our WhatsApp platform.
Oh, good.
Those that are not here, also
okay. Oh, good. That makes sense.
I think it's more than 3 minutes now.
Okay. So, all right. Should we, because it's 41%, should we, okay, that's it, right?
Do you want to give, do you want me to give you more time for this, or it's okay?
To be honest, I'm not sure. I don't think there's anybody else feeling this. It's been 22 people since. So should we wait for like 30 seconds?
Okay.
Let's see. Now just submitted. Let's see, because I don't want us to end it while someone is trying to fill the form, you understand, to answer the questions. Okay. I think it's fine, to be honest.
Okay. All right then.
Yes, I think it's fine. Thank you very much, everybody, for participating in the pre and post tests on regular dental care. Thank you for joining in. Thank you for listening. For those that joined us from abroad, thank you so much. And Mrs. Temitope Adedewe, you left your email and contact number, and we would send you the link to the next podcasts. So there's no podcast next month. So probably till next year. Thank you.
Thank you so much.
Very much, everybody. Okay, Mrs. Olorino, is there anything you want us to do?
All right. Thank you very much, everyone. Dr. Moshebi, thank you. Medical think tank, thank you. Dr. Moshebi refused to give us the amounts, you know, that we can do veneers. She doesn't want us to look like celebs. Can you just imagine? Okay, that's fine. No worries. We'll see at the back for that. Thank you very much.
Yes, Abby. Exactly.
Thank you.
It's very educative and enlightening. We really did enjoy, you know, everything that you told us. A lot of us would think, oh, is it not just to brush my teeth? But apparently you put a lot of depth into it, and we really do appreciate the way you answered our questions as well. Thank you so much for that. And also for the medical think tank, you've been doing amazing. Thank you for holding the reins, when it comes to this medical podcast. We really do appreciate all of you. And I'm sure we appreciate all of you because, you have the awards to show for it, right? So thank
Yeah,
you
all
very
of you. You're one of the all of you.
Thank you.
Thank you. Thank you, my darling sisters.
Thank you for thanking us.
Yeah. Thank you for the gift
Thank
of
you,
you.
Dr.
That's what I say.
Thank
Thank you so
you.
much.
Dr.
Um,
Funke
Thank
Thank you so much.
thanks. And for my
All
COWLSO
right
sisters,
then.
there's no medical podcast without you. Thank you so much for joining today. Thank you for always, being a part of this, for making it a success. Really do appreciate your data, your time, putting it aside to even listen to what we have to say. We really, really, really do appreciate. And we hope that by next year, it's going to be greater than this. We have a lot of things in the pipeline for next year, and part of it also, because it's collaborative, we want you to fill the forms and, put everything you think, you want to see, whatever topics, just put it in there. It doesn't only have to be medical, put whatever topics you think you want us to, talk about more and bring subject experts, to talk about it. Yeah, so that's it. Thank you for joining. We'll see ourselves again next year. This is the last podcast for the year, and it's been amazing. So thank you everyone, and see you all next year.
Thank you very much. Thank you.
Thank you so much.
Thank you.
For having me.
Bye.
Thank you,
Bye.
Mr. Bye.
Merry Christmas.
Thank you.
Yeah.
Thank you. Merry Christmas. Enjoy your Christmas.
You
Bye.
too.
Bye.
Thank
Happy New Year in
you.
advance.
Is on
Merry
the
Christmas.
call.
Thank
Is
you,
on the
ma.
call, but she says she's an attendee, so that's fine. Thank you very much for joining us.
Dr. Boyle, my God, it's off.
All right. Thank you, everyone. Bye.
Thank you. Bye-bye.